So good evening. As I mentioned earlier, my name's Karen Blake. I'm a midwife by trade and have been working in clinical practice for over 20 years, probably getting closer to 25 years now. So clearly I started being a midwife when I was about 15 years old. I have been working at Health Alliance in the Northern region as the head of clinical informatics for the last few years, and I'm also on the board of HINS. With me today is Billy Allen, who is the Manager of Pharmacy at the Ministry of Health, Lindsay Birmingham, who is the General Manager at Nelson and Bays Primary Healthcare, and she's a nurse by trade, and Ruth Large, who is the Chief Clinical Officer at Home Care Medical. Welcome everybody to our webinar tonight on telehealth in primary and community care settings. It's wonderful to have you all join us this evening. We will have a poll that is live. So we've got 5 questions on the poll that we're going to be opening now, and I would invite you all to complete those, and we'll have a look at all of the answers towards the end of the webinar tonight. There's also a question and answer function, so I'd love for you all to send in your questions. I've got a few questions for the panel to start to get us started for the evening. But if you would like to start sending in some questions, and I can see that we've got one already in from Pauline, so that's absolutely fantastic, and we'll get to all of those questions. So the first question I'm going to ask the panel is a bit of a twofer. So the first part of the question is, what do you see are the positive steps that have improved adoption and the use of telehealth in nursing, midwifery and allied health across primary and community settings? And the second part of the question is, what are the remaining challenges and how do we start to remediate those? So Lindsay, let's start with you. What are your thoughts on the positive steps that have improved adoption, and what else do we have left to do?
I guess a lot of people wouldn't call COVID a positive step, but it certainly made the big move for most people to adopt telehealth in a very quick turnaround. And although a lot of practices in primary care and other organisations were telehealth ready, I think when a point came that there was no alternative, it was adopted very quickly and very well, very successfully, I might add. So yeah, I think that was the big step that moved everybody into that telehealth arena.
Had you been using telehealth before COVID, Lindsay?
We were telehealth ready, and we were doing some outpatient appointments with Nelson Marlborough District Health Board. So we had been doing it. We were just trying to advocate the uptake. So yes, it was on our agenda anyway. So yeah, we've been using it for quite a few years.
And what do you see as being the remaining challenges, and how do we start to remediate those with adoption of telehealth in primary? I think
for people to trust, I just think for people to trust it, the ability of using it more, and just try and see the benefits, not just for organisations, but mainly because for the patient benefit. That's the key thing for me. We are a patient-centred health providers, nationally, and so I think we should start looking at the benefits to the patients.
Right, good point, Lindsay. So Billy, from your perspective as a pharmacist, what do you think are some of the positive steps that have improved the adoption of telehealth? And then the second part, what do you see as being the remaining challenges that we need to remediate and start to address?
Kia ora, everyone. In the pharmacy sector, we don't actually have a good view of what is being undertaken in the telehealth field. We don't have a clear sight of it. We've got good anecdotal reports of pockets of being used, but we don't have a view across the country of how it's being used. And we've got no comparator, before COVID and what impact COVID had on use of telehealth. So I'm going to put a plug in here. We're actually working up a survey with the University of Auckland and Massey for a survey of pharmacists and customers to see what both parties want and what extent they're using telehealth in a pharmacy setting. Because we don't have that baseline like you had in primary care. So it'll be interesting to see what people are actually doing.
Now that sounds like a really interesting piece of research, Billy.
Yeah.
And that will hopefully start to address some of the, start to shine light on what some of the issues are that we need to be working on as a community.
Precisely.
Yeah, great. So Ruth, the same question for you. What do you see as being some of the positive steps, across the different disciplines in primary and community settings to uptake and adopt telehealth? What do you see as some of the remaining challenges that we need to address and remediate?
Yeah, look, I think the first thing is we need to recognise that the technology has improved markedly in a relatively short period of time, and we were very fortunate in the way that COVID hit when it did, because we've been using cloud-based technology, and an application type approach to some telehealth was already out there. I guess when we think about telehealth, there's still a huge amount going on by the telephone.
Mm-hmm.
And I think that's been really easy for people, particularly clinicians, because it is easy to pick up the phone, but it can also be a barrier for patients, who would much rather actually, be able to visualize who they're talking to. So I think that in terms of the things which have been broken down, I think it's just that key point of having patients then say, yeah, this is fine, but could you? That's made quite a big difference. So I think we felt there's been a big challenge in the community, and for those people in the allied health, pharmacy, nursing fields who often get sort of quietly just beaver away and do this stuff, particularly in my experience in the DHB setting, all of a sudden those people who are doing telehealth were like, oh, hey, you're doing this stuff, can you help us? And I think that's been really great. So there's been lots of stories, which have been really positive about, hey, we're doing this stuff. So that I think has been really good at moving people along.
Right. And what do you see as some of the remaining challenges that we need to be working on, Ruth?
Well, again, I think the technology we have challenges with, particularly booking patients in, the amount of time that it takes. We're in a really high pressure environment. And if you've only got a set time for an appointment, then that's going to limit how much time you're prepared to spend getting that video right. And I think, to go back to Lindsay's point, we're going to do stuff which benefits patients, but often we're going to do that in the context of how many patients can be served. So it's quite easy to go, let's just go back to the old way because it's quicker. So I think there's a mindset change as well as a let's get the technology right. And I think also people are still scared, of using this technology. What can we use it for, and how do I find the time to get my head around the space? And obviously webinars like this help, and I hope that everybody will have a look at the website and what's on there as well. But I think that we should also really be aware that if we as a health community don't do this stuff, pick up the ability to video with our patients, then we're effectively going to be done too. And I think that's particularly, be really fascinating to see what's happening in the world of pharmacy that Billy's looking into, because I think that's a whole untapped area where patients could benefit immensely from the skills of a pharmacist. And I'm not sure that we're really getting that benefit yet. It'll be fascinating to see what happens with Billy's stuff.
Absolutely. I think that sounds like a really interesting piece of research. I'm looking forward to those results as well. So one of the things that I've been thinking about as we've been preparing for this is there's been a lot of, it's been a lot in the media about, general practice and outpatient clinics and uptake of telehealth, especially, it's now a year since we all went into lockdown and things really changed for us in New Zealand. So I'm really interested to hear from your different perspectives. How is use of telehealth by nursing, midwifery, and allied health professionals different from that of our medical colleagues? And why are there those differences? So, Billy, let's start with you for this question first.
Yeah. I'll answer it in three parts. First of all, pharmacies used asynchronous telehealth quite a lot, and it has for some time. So that's sending like text messages, reminders around, get a new repeat prescription, your medicines are ready for collection, that sort of thing. So the asynchronous stuff where no response is expected has been going on for a wee while. But pharmacy tends to have an interaction with patients in an unplanned way. So it's in response to a prescription, to a supply of a medicine over the counter. So the advice is usually provided at the time of supply. So it's the supply that actually triggers the provision of information a lot of the time. So the important thing is to make sure that if you're making separating your supply, for example, home deliveries or remote deliveries, how do you provide that advice? And if you do home deliveries, you haven't got the same workflow with your patient there in front of you now to provide the information. So pharmacy is going to have a re-engineering of its workflows to make time that's convenient for the patient so that they can have that telehealth interaction. And I think that's a bit of a challenge for pharmacy because it's uncoupling the supply from that information. But from a patient point of view, from a safety point of view, I think it's critical that we don't totally disassociate those two. We can't have just supply of medicines without that good advice that goes with it.
Great. No, I think that's a really interesting point. And Billy, you talked about synchronous and asynchronous communication, and there might be some people on the webinar that aren't familiar with that term. Would you be able to just spend a couple of moments talking about the difference between synchronous and asynchronous telehealth?
Sorry, I've been on too many of Ruth's webinars before. So synchronous is in real time. So we're having synchronous discussion, whereas asynchronous is where it's dissociated. So I send out a text to Ruth, and Ruth reads it at a time that suits her. It may be immediate, or it may be tomorrow, it may be never, but it's disjointed. It's separated in time.
Great, fantastic. Thanks for clarifying that, Billy, for our audience. I hope that's been useful for anyone who was thinking, I don't know what he's talking about. So, Lindsay, over to you from your nursing.
Sorry, I've got one more.
Okay, sorry about that, Billy.
The other challenge for pharmacy is we don't only supply medicines. We've got our clinical services where we actually do medicines use reviews, providing support for adherence to medicines. Now, those activities are more planned, and you can make an appointment. So some of those interactions could be through telehealth. Typically, though, it's done in the pharmacy, but it doesn't have to be, particularly if it's a series of interviews. The first one may be in person, but there's no reason why, if it's suitable for the patient, that subsequent interviews couldn't be virtual through telehealth. So for me, there's those three situations, and it's those sort of things we're trying to tease out in the research to see what is actually being used, and then what are the barriers to increasing uptake.
Great, fantastic. Thank you so much for that. So, Lindsay, over to you from your background in nursing. How do you see the use of telehealth is different for nursing, midwifery, and allied health professionals?
From talking from where I am now in primary care, the nursing tend to use a lot of telephone consults with patients for follow-up and advice, etc. So that's their main body of interacting with the patients. The midwifery team that we have on board are just trying to work through doing some actual virtual consults with obstetricians. So they're really engaging in actually using that platform to actually make things happen for their women. And I think the nursing in particular, they do a lot of training, etc. online now. We've moved to more of a virtual training arena rather than doing practical workshops. So that has been really received and taken up by the nursing teams really well.
Great, fantastic, thank you. And Ruth, from your perspective as a doctor working in telehealth, how do you see the use as different across nursing, midwifery, and allied health?
Yeah, and I look remembering also that that my principal experiences from the district health board, but we there's a large amount of telephone advice, as Lindsay says, that goes on, and I think that's been our mainstay, and often one of the first things you do, you hear when you phone your general practice is you can go through the nurse helpline. And we've also got nurses within the community who are having district nurses, healthcare nurses, lots and lots of nurses out in the community. And of course midwives, as we know, use a huge amount of telephone to check up. So it's I think moving that along, and some of our health professionals have been fantastic at it. A really good example is speech language therapy, because where you suddenly get this ability to see the person and be able to coach them through. And physio, we're seeing that as well. You can actually look into somebody's home and you keep them moving. So I think there's a difference. The difference in my mind is really in the way we practice, whether that's supported practice or whether that's practice that is within or top of scope. And it's making sure we all think about the same things, keeping our patients safe. I don't think we necessarily need to be working any differently in a way from how we already do it. Maybe it's thinking about how you incorporate these sort of things into your work stream and keeping your patients safe, if that makes sense.
No, it does. And interesting when all of you have talked about, that the texting that we've always done with patients or consumers and the phone calls that we do. Certainly that's been my experience in clinical practice as a midwife working in the community. I would be triaging women in labour over the phone, having text conversations with women in labour antenatally and postnatally. There's nothing like a phone call from a woman, at 4:30 on a Friday afternoon, who's so excited that she's in labour, and spending a few hours talking, with her, in those early stages of labour, making sure that women can labour at home for as long as they're comfortable, or then progressing onto a home birth or coming into hospital or birthing centre. So I think it's something that, certainly from nursing and midwifery that we're really used to doing. But it's a big shift to then go away from, those sorts of interactions to the planned visits. How do you do an antenatal or a postnatal visit, using telehealth? Because those are often quite high touch encounters with people where you're having to do a physical examination.
Yeah, I think sometimes it's having a plan for when you do need to do the physical examination. So your patient really needs to understand the limitations, and you need to be able to understand the limitations, and there needs to be an agreed sort of like, okay, if this, then that. And I think that's it. See, I don't think we should think about it as it's either or. Sometimes it's actually both.
Yeah,
it is. It is, and certainly that was a lot of my experience. So there might be sometime when I would call a woman to say, how things going, and maybe things aren't going great with breastfeeding, and I need to convert that into I'll just pop around and see you this afternoon, and let's spend some time working on breastfeeding, or whatever it is that's going on for them. So it is about that kind of multimodality and the way that suits the patient first. So I've just been having a look at the questions that we've had coming in. So welcome to everyone who's joined us in the last few minutes. We've got a live poll going with 5 questions if you've got time to answer those. And we've also got some questions that people have been posing. And we've got a really interesting question that's just come through that I'd like to pose to the 3 of you. Do you think we're pushing the use of telehealth too quickly within health sectors and for patients as well, primarily as a result of COVID-19? So Lindsay, let's start with you first. What's your response to that question that's come in?
Sorry, Karen, I didn't hear the first part of it. Can you just repeat it?
I'm happy to repeat that. Do you think that we are pushing the use of telehealth too quickly within the health sector and for patients as a result of COVID-19?
I think we've taken the opportunity, very much so. I wouldn't agree that we're pushing it too much because of COVID. I think what's happened is we were already trying to promote it, and that just was an opportunistic time to actually push it more. We've seen the benefits, so I don't think it's necessary we're pushing it too much. I just think we've grabbed that opportunity when it's arisen and just ran with it. So that's my opinion on that.
Great, thanks. Love hearing your opinions. That's why you're here as one of our panelists this evening. Billy, what's your response to the question that's come in around the use of telehealth and the accelerated pace?
I think we probably did push it a wee bit by necessity during COVID. And we tended to forget those people that want an in-person encounter because that's their style, that's what they would like. But also the third of the population that don't have good access to either the device or the data or the Wi-Fi connection to actually have the encounter. So I think we've got to make sure we have going forward, we have that balance to give both the practitioner and the patient the option, and then the ability to switch, if you said before, if you need to have a physical examination or be with the person, you can actually switch and actually have an encounter in a more face-to-face way. So I think we did push it a wee bit much, but we had to.
Fantastic. Ruth, what's your perspective on this question?
Yeah, look, I think that's a really, really great question. And it's a different perspective, I guess, for those of us who've been living in this telehealth space for quite a while. You know, the New Zealand Telehealth Leadership Group is coming up to 10 years old. You know, those of us would say we actually, if we had been better prepared, we wouldn't be in this position that we're in right now. You know, if we had people who were listening to the push that we were trying to give, you know, we wouldn't have had to have such a big drive to keep our patients safe in this manner. But I think really it's about thinking about why and what for. You know, so we need to separate that. You know, we shouldn't just be doing telehealth because we can. I mean, that's just silly, hey? You know, it's building dinosaurs out of Jurassic Park. We shouldn't do it just because we can. What we should do it for is to keep our patients safe, keep our staff safe, and to make sure that we're providing really good quality care the best that we can. To places of need as well, so it expands our reach. I mean, that's what tele means. Hey, like a telecucumber, it's long, it expands its reach. So I think it's a really great question. But my answer would be that maybe if we had pushed it harder to begin with, you know, we wouldn't have had to make people so uncomfortable with the COVID.
Yeah, I think if I reflect on my own experiences as a consumer in the last 12 months, I had a telehealth consult with my general practitioner during lockdown because that's how we had to talk to our general practitioners at the time. And I've been absolutely delighted since then that I've had the choice. And I've gone and seen my GP in person when I needed a physical exam. And there was, you know, a few weeks ago, I just needed to have a conversation with my GP. And I was, you know, I live rurally, and it was fantastic. I didn't have to drive 20 minutes to get into the centre. I didn't need to find a park. You know, my consult was about, you know, 10 minutes long, which was fantastic. And I probably got about an hour back in my day because I didn't have to get in the car and drive from the country into an urban setting to go and see my GP. So I think having choice for me as a consumer perspective is absolutely fantastic. We've got a question that's just come in, Lindsay, for you in particular. Can you give an example of how you're addressing the digital divide in your health setting?
Can you just, Katrina, maybe just add a bit more, because I don't really understand the question there, to be honest.
Okay, Katrina, if you can just give us a little bit more information around what it is that you're wanting Lindsay to talk about, and then we'll come back to you.
Karen, shall I just maybe just talk about the digital divide quickly, just in case people can just store that in their banks, so that they know what that she's talking about, because sometimes people, what is this thing called the digital divide? So just briefly, the digital divide refers to those, I guess, the haves and the have-nots. So there are lots of different reasons that people can't access digital tools. They may be for socioeconomic reasons, they may be because of literacy reasons, whether that's health literacy, digital literacy, or language, or it could be because they're living in a remote or rural place where they don't have access. So when we talk about the digital divide, it's how do we mindfully recognize that there is this gap and address it. So just for those people who are wondering what that term means. And there's a map, by the way, a digital divide map. Sorry, Billy.
So that's why I was saying that we need to make sure that we're offering it, the telehealth for those that can use it, and we don't insist that those that can't use it have to use it. So it's having that balance and having a basket of in your kitty of the way you interact with your patients.
And I think it's also really important that we don't just design these tools so that they can only be used by certain people. So where we have people who can't use them, we should be looking at supplying devices. We should be looking at providing opportunities in the community for people to have a video consult where they need one, and that is happening in various parts of the country. In fact, if people are interested, they can go onto the Telehealth website. And there's a list now which should be live of projects which are happening, and there'll be a few in there and we put a equity lens on that. So if you have a look at the equity ones, then there'll be specific projects there.
So thinking about the digital divide and things that we might be able to do to start addressing that across different health settings, has there been any consideration to having a digital prescription? So that might be something that you might like to consider, Billy, as a pharmacist, that your GP or your practice nurse could write a prescription and prescribe you a device, a data plan, and that's funded by the Ministry of Health or Pharmac as easily as it is to get a prescription for medication.
Yeah, because that would be a nice way of getting it distributed to and targeted. Yeah, and it wouldn't necessarily have to come from a pharmacy. It could be a prescription you take to a supplier of IT products.
That's right. It could be a prescription that you take to Spark or Vodafone or 2 Degrees or another supplier.
Yeah.
So, and that was actually one of the things that we went to the ministry with, talking to them about, how can we do this? How can you write like a green prescription?
Yes.
So you would actually sit down and say, my patient needs X, Y, Z. And there are a number of hitches with that in terms of some of it was funding, and we never got it over the line in those early days of COVID. But I do know that there are a number of DHBs, Waikato included, which looked at distributing devices to those who might need them. And remembering that the ministry did come through with some data-free sites as well, which makes a really big difference to people if you've got a bit of data.
Yeah, right. And a digital prescription isn't something that exists yet. That doesn't mean we can't get it in the future. No, fantastic. Hey, please keep the questions coming in, team. It's wonderful to get your questions coming through. So a question that I've got is, and Ruth, I'll get you to answer this question first. Do you think telehealth changes the relationship between the consumer and the care provider?
Yeah, look, I think every interaction we have it changes the dynamic between the patient and the provider. I think that if it's your patient that you've never met before, that can sometimes be more challenging by video, although patients can find it quite reassuring. So that could be your first interaction, and then how does that influence the next interaction? Being able to see into somebody's home, if you're a clinician and working from home, do you have the bit of background you know, so that people can see where you work. There's lots of little bits of yourself that you can potentially expose more by video or less. And some of that is choice. But I think it certainly does alter. And I guess the other thing is, you know, when you can't see somebody, when you are on the telephone or texting, then you also remove some of those preconceived notions. You know, I mean, you've still got some judgment on voice and what have you, but you know, sometimes that can take some of those other things away as well. So yeah.
It is really interesting getting glimpses into people's lives, using, you know, things like Zoom and Teams, you know, for work meetings as well as telehealth consults. And you might have seen my husband wandering past in the background. You know, we've all had children and cats and partners and all of those things in our background. So that's, you know, something else to think about when we are engaging with, you know, patients and consumers over video. Billy, what are your thoughts on how telehealth might change the relationship between consumers and care providers?
I see it as possibly two sides of a coin. On the bad side, it could actually be because it's less personal. Some people don't like that. Some people do like to meet in person. But another side, like you were saying, it gives people time and your reach is greater. So you actually could have more but shorter interactions with the patient if that was appropriate, because it's easier just to have a quick 10-minute video than to have to go and take time off work and travel and park and all the other bits that go on with it. So it could, if it's used correctly, I think it could actually increase your reach. But we've just got to be careful that those people that want the in-person get it when they need it as well.
Yeah.
So it comes back to that balance, that it's not a either or, it's an and.
Yeah. Yeah, great. So same question to you, Lindsay. Do you think that telehealth is changing the relationships?
Yeah, I agree with what Billy said there, actually, Karen. But one of the other positive things that we need to think about is that the whānau involvement, when you're doing a virtual consult, you could actually, you know, have the whole whānau present at that consultation and have that support, which is what we can't really offer on that face-to-face consultation, because not everybody can fit in the room. But so from a practical and positive aspect, I think that will change the relationship, you know, with the consumer and the clinician by allowing the family, the whānau, to be present.
I think it'd be great for family conferences, particularly when the family are in different towns and things, so they can still participate face-to-face without having to travel and again, take time off work or whatever.
Yeah,
I think it'd be a powerful tool.
Absolutely, or even people that are living in different countries while we've got closed borders. Yeah, I mean, I'm thinking my daughter just had surgery in Melbourne today, and she told me how great her doctors were, and I really did want to see a transcript of their medical school records and an audit of their last few surgery, you know, last audits that they've done, and you know, I'm thinking about it now, and I could have just, you know, done a quick telehealth consult with the doctors and just made sure that they were suitable for operating on my precious girl. Since as a mum, I couldn't be there at the moment while we've got closed borders. Hey, we've got some great questions coming in from Pauline, who's really keen to reach out to other people outside of general practice. So sounds like you're looking to network, Pauline. So welcome to the group tonight. And you've posed a question to the panel that I'd like to address. So, do we see telehealth as a way to improve collaboration between different professional groups, but also to improve wraparound care? So not more faxes, obviously, we don't need more faxes, but face-to-face between, say, GPs, nurses, midwives, obstetricians, and then what platforms are people using for this? So of the three panelists, who would like to respond to Pauline's question? Great, Lindsay, it's over to you.
We've got a really good example of this. We've done some wraparound care for a patient that had a consultation with an oncologist in Christchurch, and we had the GP in the room, the district nurse in the room, the OT in the room. So all the care that was planned, it was all planned and mapped out with all the key people in that room. So very, very positive to do that and have those MDTs consultations like that. Yeah, so it does work, and it is of benefit.
Yeah, fantastic. Thank you. Billy, what are your thoughts on that question in from Pauline, and what sort of platforms have you been using in pharmacy?
Sorry, platforms I can't say, but I can see a great use for interdisciplinary team working. Traditionally, you all have to come in, from your different workplaces and meet usually in the general practice. But why not do it virtually? And you may even be able to do it with someone in the patient's home as well. So you've got the patient involved. I see it as a great tool for that. Where it might be useful from a community pharmacy point of view is when you've got queries around prescriptions and things. But the challenge there is how you do that within both your workflows, when you don't want to interrupt the prescriber necessarily when he or she's in clinic with a patient. So you have to work out some sort of protocols of ways of doing it. I'm sure it's not insurmountable. It should be doable.
Billy, can I just... Oh, sorry, thought you'd finished.
Actually being able to eyeball someone is much easier and to have a discussion, I think, than doing it on the telephone.
Sorry, Lindsay, what were you going to say?
Oh, just about what Billy was saying there. We do that interaction through because we use Indices as our PMS. So we have as interaction with this pharmacist where they can send an instant message into the GP while they're in consultation. So they'll get the answer in real time, but it doesn't interfere with the consultation with the patient at the time. So that's a platform we use at the moment.
But is that a verbal word, typed question and answer rather than verbal?
Yeah.
Yeah.
Well, you get, I think for the benefit there is that you'll get an instant response, whereas trying to get a doctor on the phone can be quite difficult when they're running their appointments. Yeah.
But I was just thinking for the nuanced question, I think you need that discussion. You can't rely on just simple answers. So I think it's a balance of having both systems available.
Yeah.
Great. Ruth, what are your thoughts on kind of multi-disciplinary collaboration using telehealth tools?
Oh, look, I think it's about time we all evened the playing field a little bit and recognised each other's skill set a lot better. I think, growing up in the DHB environment, which has been very SMO orientated for a long time, digital tools and including telehealth are a really great leveller. And certainly the allied health professionals are leading the way in the way we deal with patients. So that's the first thing I would say. But, multidisciplinary teams have been using this method for quite a long time across the country. And I mean, if we look at child health, for example, one of the first sort of MDM type settings was with Starship touching all of the other paediatric units in the country, and that's still going. So, there's certainly precedent for doing that, and I think we should have the expectation that we increasingly recognise the skill set each other brings, and to deliver much more holistic care. So, yeah, I think it can only do some good, but use wisely, like Billy says. Again, it comes back to we don't just want to do it just for the sake of doing it.
Yeah, and certainly when we've got subspecialties and there's not lots of them across all regions, it's a way of accessing people that work in subspecialties who have particular expertise in one type of care or treatment, that we can access that across the whole of Aotearoa, or even going offshore to expertise in other countries. Fantastic. Just going back to the last question, thinking about the relationships between consumers and care professionals, a really lovely comment in from Susan saying that their community nurses have found that telehealth consults evens out the patient-health professional relationship. So patients can feel more in control compared to having a consult with our nurse in the home. That's really interesting comment about breaking down some of those power dynamics that have been so pervasive across medicine, and and providing care. Billy, we've got a couple of questions in for you as a pharmacist. So how do you think that telehealth would enhance medication optimization? Would be love to hear your thoughts on that.
So medicine optimization is the proper use of medicines, the safe and effective use of medicines. So it depends which part of medicine's optimization, because there's a spectrum of activities. I'm going to assume that Katrina's meaning the end where you're looking at medicine's review and the appropriateness of the medicine regime that a patient is on. I think that some of that and some of the adherence support type activities that go under the pharmacy LTC program could be done through telehealth, particularly if you want to have several meetings, because you may not be able to solve everything in one sitting. You may have to have several bites at the cherry. So you could have the initial meeting in face-to-face, in person, and then subsequently could be on virtual. I think we've got to be careful, though. We talked about going into people's homes before, and what you see when you open up the bathroom medicine cupboard or the bedroom cupboard and see the range of Ventolin inhalers or whatever it is that they've been collecting religiously for the last 4 years and never been using. You won't get that through a virtual consult unless you ask them to take their camera around with them to the bathroom cupboard. So again, it depends on the person, what you're trying to achieve, what sort of medicines they're on, what the perceived problems are. So it's a tool, it's not the answer to everything. But I think it could be used more.
I think that would be really interesting sort of consult, Billy, to have a pharmacist come and go through our medicine cabinets about all of the leftover medications that we all have just in case. When people talk about e-medication or e-prescribing, and it's we've tracked what's been prescribed and we've tracked what's been dispensed, but we never have a way of tracking what's actually taken by patients, about over the counter medication sharing between families. And people just using a bit of what they've got left over from last time something was prescribed. What's the actual lived experience of patients, patient-reported outcomes with medication adherence. We're not, that's not on any e-prescribing app that we've got at the moment. I think that's really a big gap in the system.
And we know that adherence is across the world, at best, is about 55%. People don't take the medicines as was originally intended. Yeah. And that's part of medicine optimization as well, is to make sure, or to encourage patients and support patients to be able to take the medicines. Yeah. And I think we can use telehealth more there, whether it's asynchronous texting, remember to pick up your prescription, your dose is due now, or if it's a more formal telehealth type interaction.
Yeah, fantastic. I'm just going to remind everyone, we've got another 5 minutes before the poll closes, so please get your answers in. And we've got another question that's come in around, are there any tools we can use to measure how well we're utilising telehealth in each health profession other than surveys? And thinking of tools, as I said, I live in the country and the sun's setting and it's all gone dark behind me. So I'm going to use the tool of light and go and turn that on so that I'm not sitting in the dark by 8 o'clock. So who would like to answer that question to start with while I go and turn some lights on in my house? About how we measure how well we're using telehealth.
It's, for me, I'll start. It's very subjective, and it depends, I think, on the person's experience of that interaction. Perhaps we could have it like after Zoom finishes, you get these 5 little stars that come up and you rate the quality of it. Perhaps we could use something like that, plus a little bit of free text, so you could actually give some context to that.
Fantastic. Lindsay, are you doing anything in primary care and in the Nelson Bays around kind of assessing how well people are utilising telehealth other than surveys?
We assess how many people utilise it just through a patient management system. So we do a report on that monthly just to see what the uptake is and how many appointments are made as a virtual appointment. So we do keep a record of it and keep a report. Yeah, but we've not done anything in particular about how well the patient actually found the consultation. So that's an interesting point about having that pop up afterwards.
Great. No, I think that is some research maybe that we need to do. We're thinking about your work at Waikato DHB and now at Home Care Medical. What are the different ways that you've seen around people measuring the utilisation of telehealth?
Yeah, look, I mean, that was one of the first things that we really looked at hard in the Waikato is how do you build a dashboard so you know what's happening? Because what you don't want to create is a service that is skewed towards one population or another. And the only way of finding that out is actually by collecting the data. So the first thing you need is a good data collection tool, and then you need to display it. And for us in the DHB, it was looking at by service, and then obviously the demographics. So ethnicity, of course, really important, and age. Now, when we start getting into the primary and community sector, it's just as equally important that we collect that data. But as you know, Karen, it starts to become expensive. You know, how do you collect that data? How do you know what you're doing? You know, is it a way that you can build that into your patient management system of being able to flag a telehealth consult and bring it in? I mean, do you just need to do an Excel spreadsheet? There are ways of doing it, and I mean, Karen, you'd be far more expert at this sort of stuff than me, but I think it's really important that we do that, and certainly from the home care medical perspective, you know, which supplies Healthline and a number of other lines which we don't have time to go into, but you know, we're looking all the time at volumes. Now, how that transposes then to care the patient receives is the interesting part, hey? Because it's the utilisation part, and that's where, you know, that's what Billy's getting at, and the, you know, the quality, and how do you rate that? And I know from our experience with Smart Health, clinicians are really scared about rating, you know, so I don't think we've nailed that one yet, but it's a great one to discuss more, I think.
It is, and I think there are other metrics that we can be measuring. So we know across our DHBs and outpatients, a DNA rate of around 30% is pretty average, despite all of the work that we do to try and change DNA rates. It would be really interesting to do some work to measure the metrics of how many people turn up to a telehealth consult when they don't have to drive, get a park, and there might be equity issues around, you know, cost of parking, access to transport. So I think that there's a lot of work that we could be doing and understanding what it's like from the patient perspective. We've probably got more questions that have come in than what we're going to have time for, because we do want to get to the polls. Really lovely comment in here from Annette, finding huge benefits for distant consults via telehealth compared with phone calls, such as being able to have more than one person we can communicate with, like, you know, a mum with a teenage girl, and being able to screen share. So not only passively provide information, but to go over to explain and answer questions. So that's using some of those teach back skills that we've learned about Annette. So I think that's a really great perspective that you're bringing into it. Really interesting question in from Lucy that I'd like us to spend some time talking about, and then we'll go to the polls. So how is telehealth useful if a patient's diagnosis is unknown? So Ruth, I'll get you to answer this question first.
Yeah, look, I think there are varieties of that. So the question, I guess, if we flip that around, is can telehealth be a diagnostic tool, or can it manage symptoms? And often we do go into symptom management if we don't actually know what a diagnosis is. And being an emergency physician, I'm interested in, is this going to kill you? Is this going to maim you? Or can we wait? Is there a tincture of time? You know, so I think you don't necessarily need to know your patient's diagnosis. What you need to know is the urgency, the emergency, and where to actually go next. So that probably hasn't answered that question very well, except to say that I don't think you need to have a proven diagnosis to contribute to patient care.
No, great point. What are your thoughts, Lindsay and Billy, on that question?
I think if it's a good tool to, like Ruth said, to gather those symptoms and have those conversations with the patient and look at what symptoms that they're presenting with. But I think it's just more of an ongoing support. It could be, you know, used as an ongoing support mechanism until a diagnosis and after the diagnosis, actually. Yeah.
Great. Billy?
I think you could still use it, as Ruth says, for symptoms, because I was just thinking of the emergency contraceptive pill. You know, a lot of that is around a verbal description of what's happened, and, you know, I didn't have protection at the time, that sort of thing. You don't necessarily need the lady physically in front of you to make that consult. The challenge there is how you get the medicine to the patient, but that could be done by a home delivery, a courier or something. So I think it can be used, particularly in pharmacy, where we don't do a lot of diagnosis and, you know, the poking and prodding type diagnosis that perhaps a nurse practitioner or a general practitioner would do.
Right, and that's certainly what I was thinking when I saw that question, that, you know, there are some diagnoses that are, you know, are quite obvious and easy to treat and manage, and some symptoms can be managed over telehealth. And sometimes you don't always need a formal diagnosis to care for people. So I think it's one of those answers where it kind of depends on the situation and the patient and what you're doing. So that's great. I'm just thinking, looking at the time, we've got another 7 minutes, and I'm really interested to go and have a look at the poll for what you told us. So can we have a look at the poll results? Are we able to have those up on the screen, please? Fantastic. Thank you so much. So let's just go through this. So we had 5 poll questions that we asked people. So the first one was, when did you do your first telehealth consultation? So interestingly, 41% of you have never done a telehealth consultation, 3% in the last week, 3% in the last 3 months, 14% in the last 6 months, and 38% of us was over 6 months ago. So it'd be interesting to understand from those of you that have never done a telehealth consult, what are some of the barriers to adopting telehealth, and what are some things that we can do? So that might be interesting to hear from people that have answered the question in that way. And the second question, in the last 4 weeks, what have been the primary ways you've conducted consultations? So a combination of video, telephone, text, in person, and other. Is this normally what, so when people are polled on the different modalities that they use, in your experiences, Ruth, what sort of modalities are people mostly using?
So we're talking, actual tools like DoxyMe,
Yes.
or yeah.
So when I'm talking about modalities, it's video, telephone.
Oh yeah, so the majority is still by telephone. You know, we've seen that. You know, people will still prefer to pick up the telephone, and video comes after that. Although it's a little bit of a tirade, because there's still quite a bit with you know, email and text. You know, if you look at volume, but most is by telephone. Video tools in the community, probably the biggest one being used is Doxy.me. And some which are inbuilt into the PMS, and Teams and DHBs is the
Yeah, fantastic. Thank you so much. So the third question, after COVID-19, do you see telehealth as a regular tool for health delivery? So 83% of you thought that it was, with the rest of you thinking that it was only by exception. Looking at what sort of experience have you had with telehealth using video? So some people, you know, over 50 consultations, 21% between 10 and 50 consultations, 21% 2 to 10, and 52% of us have never used, you know, video to have a telehealth appointment. So I think we've got, got a lot of work still to do to increase adoption and the use of telehealth. And looking at the different roles, wonderful to see 14% of us are midwives here today, 34% nursing, 17% allied health, 7% GPs, 7% specialists, and 31% of other disciplines or people working in the community or consumers. So welcome to all of you. So some fantastic poll results, and thank you so much for participating in that. I'm really aware that we haven't gotten to everybody's questions. Some really lovely, rich questions that have come in, and we'll pose those to the panel, and we will look to incorporate some of the questions that you've posed in future telehealth seminars that the Telehealth Leadership Group is running. So thank you so much. So I'm just going to invite Billy, Lindsay and Ruth to just give some passing thoughts and to say their farewells to everybody. Billy, if we start with you.
I'd just like to encourage all the pharmacists that are watching to participate in the survey when it does come out, to give us a good baseline to know what's actually happening. What's your motivation to continue on or not with telehealth? How can we enable that, particularly at the ministry, but also through the sector organisations, to help people take on telehealth in a more positive way, if it's appropriate. So please complete the survey.
Wonderful, thanks Billy. Lindsay?
I'd just like to thank everybody. It's been a really good turnout. One of the things I'd just like to say is I'd like to encourage anybody who'd like to be involved in the primary health work stream to contact me, and I'm sure we can provide my email to the participants, and I'd be very pleased to hear from people who wants to get involved in that more.
Fantastic, thank you so much, Lindsay. Ruth, any passing thought, any final thoughts from you?
Yeah, look, I think that saying it takes a village is a really true one. I think it's great to see so many clinicians engaging across the spectrum. It's one of the things I love about telehealth, that we've got all of these different health professionals engaging together. We're stronger when we do this together, and we're stronger when we learn together. So, for all of those people, I think Lindsay said it as well, sign up to the forum. It's the Ministry of Health supported and funded. So you're paying good taxpayer dollar for it. And we should use that taxpayer dollar wisely with as many bodies as we can. So my message, I guess, is, continue the great mahi you're doing out there, and jump on our website, www.telehealth.org.nz, because the whole idea of that is to support clinicians to deliver great care for their patients.
Fantastic, thank you, Ruth, and thank you, Billy and Lindsay, for your time, your wonderful responses to the questions posed by myself and through the participants here this evening. Thank you all for joining us this evening. I've loved spending the last hour with you, and thank you for your time, and continue to do all of the amazing work that you're doing in the community. So thank you, and have a wonderful rest of your evening. Ka kite.
Ka kite.
Ka kite.